I think everyone in this room doesn't really need an introduction to the current situation of agrarian and food crisis in the country. We've been hearing about it in the morning, but just to set the context again, even before we get into the agrarian and food crisis, that we need to look at this, of course, in the broader macroeconomic context, where we see a general slowdown in growth, and also a slowdown, particularly in a way where what they're talking about, a K-shaped recovery, where there's some who are doing very well and rest who are doing quite poorly. And this is something that is not because of COVID, it's something that's been happening since earlier. I think that recognition itself is completely missing, not just, of course, by the state, but in the media as well. One interesting sort of anecdote there is the economic survey this time has this, they have these 4 panels, which has the data of rural wages. So they have the top 2 panels is male, female, rural wages in nominal terms, and the bottom 2 is in real terms, adjusted for inflation. So if you look at rural wages adjusted for inflation, even by the economic survey's own admission in their data, it's been stagnant for years now, and the last 2 years has seen a slight decline. And then under those panels, when they write the text saying what the data says, there's no mention of real wages. They just mention nominal wages and say, oh, there's been this great increase in wages. So there's so many examples that we can think of where there is this kind of hiding facts and trying to present an economic situation which any of us working on the ground find to be completely contradictory to what we are seeing and experiencing. But somehow people, even those who are suffering from the current economic situation, seem to have bought into this idea that maybe they are individual victims, but overall things seem to be going quite okay. I think when we move on to solutions or what we should do as movements and campaigns, that's something that we need to understand even more. So it's in this context, and agrarian and food crisis, again, there is no need to give really data. It's been all around us. The entire farmers' protest was an outcome of agrarian crisis. It was not just a response to those 3 laws. I mean, that was a kind of a rallying point, but we've seen a number of farmers' protests over the last many years, and clearly happened because of the crisis in agriculture, where one of the obvious ways in which it is then experienced by farmers, and that relates to the kind of demands that come out, is not getting adequate remuneration for the crops that they are growing. When it comes to food as well, again, it's always hidden in technical debates on how to measure malnutrition. For instance, now there is again this whole debate on whether the international growth standards that we use to measure stunting, wasting, and so on, which are the standard measures of malnutrition in the country, whether they are relevant to India at all, what are the genetic factors. So there's always this kind of diverting attention away from the situation. But simple surveys that we've done on the ground over the last 2 years after COVID are clearly showing that the high levels of food insecurity, where people have been reporting that their food consumption, just in terms of how much rice, how much dal, how much vegetables they're consuming, compared to just before COVID, has still not come back to the levels they were before COVID. And the levels before COVID was nothing to be proud of. They were already quite low. So even without getting into all the technicalities of malnutrition, if we think of basic nutrition, balanced diet, which all of us learn about and keep seeing on posters by the government all over the country, of a thali which has a variety of regular foods, that's something that most people in the country are not getting. If we put numbers to it, there's a calculation by IFPRI which says that 70% of Indians at the current wages that they're earning cannot afford a healthy diet. And a healthy diet they define by what the ICMR says that an average person should be consuming. And for each item in that, they look for the cheapest possible source from the market and make this calculation. So increasing anemia in NFHS. Overall, the National Family Health Survey shows that in a number of states, stunting has also increased. So there are a number of indicators other than the GDP growth rate, which is telling us that what is happening is very different from what we are hearing. And again, like I said, I don't need to be saying this in this room, but setting the context. So in this thing, the topic I was given was what are the neoliberal responses that the government is doing. And there again, I want to say that neoliberalism is also not new in this country. Like Dinesh said in the morning, that is the kind of economic regime we've been under for 30, 40 years now. But what we see definitely, and here I'm not talking very much about agriculture, but sticking more to food and welfare schemes that the government provides, is that over the last 7-8 years, that these trends have become much more intensified. And secondly, that while we saw in the earlier regime that while all of this happened, land acquisition is happening, there's displacement, there is all kinds of attacks on the Jal Jangal Jameen. There was also some little space, again, like Dinesh said in the morning, that they would do all this and then they would say, okay, social security, here is your NREGA and here is your National Food Security Act. What we find now is that even that is not there. So the struggle really is to even protect those very small kind of reliefs that were achieved as a result of quite large struggles. So while one understands that we have to look at these welfare schemes and this larger context of how people's lives are being, like employment is not being created and there's an attack on people's lives from various ways, these small protections which can help people in the short term are also needing a lot of struggle to just keep them in place. And so to give you some examples of that. So the first thing is when we talk about neoliberalism in the context of social sector and expenditures, we always talk about how there is a withdrawal of the state. And that is something that we continue to see in terms of, if you look at expenditures on all these programs as a proportion of the GDP. Once again, there's a very clever narrative built where the budget allocations and expenditures are always shown in nominal terms, in absolute terms, and it seems like it's increasing because that will always seem like it is increasing. But if you look at it as a proportion of the GDP, or if you look at it by adjusting it to prices, we clearly see across the board budget cuts. This budget, last budget, budget before that, this is the trend. Like NREGA, we are now spending this year the lowest as a proportion of GDP after 2009. PDS, which is so maligned about being a drain on the state exchequer, has remained around 1.2% of GDP throughout from 2008-9 onwards, except for the 2 COVID years. I don't have the time to go into that, but even there, it was exaggerated in certain ways because of the kind of accounting that they do. Smaller schemes, but again, very important. And we see, in the case of Santoshi's school was closed. She did not even get the school midday meal because that was the puja season at that time. And of course, her family's ration card was cancelled. The midday meal scheme in nominal terms is the same budget year after year. In real terms, of course, it's going down. ICDS, same story. If you compare the real budgets for these schemes over the last 2 years to 2014, there's a 40% reduction. And what does that mean again? That you have the same calorie protein norms, prices are increasing, real budgets are falling, so obviously the dal gets more watery, there are no vegetables, and there's no question of eggs and milk and other kinds of foods that can be more nutritious and added. PM Kisan, I can keep any scheme you think of, in real terms we find that the budgets are falling. And budgets are of course important to see how what is finally available on the ground. But not just the withdrawal of the state, I think that is one part of the game, but the more dangerous and the one which is more difficult to put a direct connection is to how the state is using the social sector to actually promote greater corporatization and more centralization. Of course, the state has been in favor of big capital even before, but I think again, the intensity with which we are seeing social sector welfare spending of the government being actually used to destroy welfare and promote the private sector. To just give you again 1 or 2 examples here, and I would see the whole digitization and this kind of thing that we've been talking since morning as part of this, where the state is spending money, but it is not really going towards the welfare of people. At the same time, it's going towards creating newer markets for capital. Health insurance is a great example here. And every year we see that the amount that is cut from the National Health Mission, which is where the spending goes into strengthening your primary health centers, sub-centers, government doctors, and so on, is the amount you see in the increase in the budgets for health insurance schemes. And health insurance schemes are schemes where government is spending money on health, but the The patient can go to either a private or a public hospital. The scheme is designed in such a way that you're incentivized to go to a private hospital, and already in just the first 5 years of the scheme, you see that 70% of the claim value under the Pradhan Mantri Ayushman Bharat Yojana is going to private hospitals. And these are big private hospitals. So hospitals which were on the verge of closure are now revived because there is a publicly financed health insurance scheme. On the other hand, what you have is that you don't have primary health centers that are growing. If a person has a simple fever, there's no way they can go for care. You have to wait to get a cancer or some sort of need an open heart surgery, then and hope that you're on this list for this health insurance, and you might go to a big corporate hospital and get some surgery. Many examples like this. The FCI, a little more complicated to explain what they're doing there. Nitin also has been bringing this out. There's one Twitter thread he did after this budget as well, where again, while on the one hand they keep talking about Pradhan Mantri Garib Kalyan Anna Yojana, biggest food distribution scheme, free food for everybody, FCI is not being paid for this food. And FCI is therefore now under debt. And very soon we will say FCI is useless, it's ineffective, it's inefficient, let's close it down. We had the whole farmers' protest, the Prime Minister makes a speech, they withdraw the farm laws. But if you look at the procurement this year, it's much lower than last year. So in theory, those laws are not there, but then how many farmers are getting MSP? Last year, the excuse was that the wheat production went down, but the procurement went down much, much more than the wheat production went down. Wheat production went down by about 16%. Procurement last year of wheat was 50%, half of what it was earlier. And this is not a farmer versus PDS problem at all. This is a problem of the state deliberately destroying this entire institution of the PDS, which has both these aspects to it, the procurement and the distribution, in the name of, again, saving money while claiming to be doing this largest food distribution program ever. Again, so it's not just corporatization, it's also then centralized solutions to food issues. So to give you the example of anemia again, there is a recognition of the anemia problem, difficult not to. Over 50% of women and children are anemic in this country. Solution is to mandatorily fortify food grains. Again, no global evidence. The global evidence in favor of mandatory fortification of staples shows very little marginal increases in the hemoglobin level. It takes, again, control away from the whole distribution mechanism from local communities. If it has to be fortified, it has to go up to some big mill and then come back in. Where are those mixes coming from? Who are the corporate interests? We don't know. There are people trying to find out and investigate this, but it's very clear that, again, there is a solution which is centralizing, which is creating spaces, which creating markets. Now we have markets, therefore, in the PDS also for your iron mix, your micronutrient mix, which apparently India doesn't make. You have to bring from somewhere. So a simple solution, which is not so simple, but a more effective solution, which is just to ensure that people have good food, of mainly comprising of what grows around them, what both in terms of animal protein and vegetarian sources, what people have been eating for centuries. How do we make more decentralized system that they continue to have access to this? There is no discussion around it. There's no discussion around what James said about people whose main source comes from collection of food from the forest. While we are reducing the access through all these sources, the solutions are, again, these centralized, huge programs where, therefore, it's not simply saying government is not spending money. They are spending money. They're spending 2,800 crores on fortification, but where is that money going? Who is it going to? So even where they're spending money, it's completely for actually promoting, creating newer markets. So I'll just conclude by saying, linking it to the previous session, on therefore what do we do? Because I don't have an answer, it's just a conclusion thing. Only thing I want to say, that what we've all been saying, that we need to talk about an alternate vision, but I think we need to start unpacking what that alternate vision is. Also about in terms of strategies of how we get there. We've been saying for too long that we need an alternate vision, but do we have one? Thank you.